We all have some level of mental unwellness.
I have been in that place of being alone.
You lost a job and you're down. Death in the family, you're down.
There are negative stereotypes that come along with having some type of mental health issue.
Embarrassment, shame, fear, violence.
And that's a label that no one wants to have.
We use these terms that demonize people and also in the process dehumanize people.
It's more difficult for them to get employment. People don't think they're going to be reliable workers.
Mental health is not separated from physical health.
Mental illness affects everyone. It affects people of all races. It affects both genders. It affects people of all ages.
It is in every one of our lives. I think people have to think about mental illness not as somebody else's problem.
Depression itself is a very isolating illness. It's an illness where people withdraw. One of the key things that we find is that very often when people, say with depression, begin to talk to friends and relatives, they feel shut down and shut out.
They weren't able to turn to other family members because those family members felt that, they should just pray. They should just, get through it.
It's something that they can't identify with. They think that it's not an illness, a sickness, or a disease that needs help. I have a special needs son, and he fell from a 4-foot wall. He had seizure disorder and he had a major concussion, which also opened up a lot of other diagnoses like ADD, ODD.
I got involved with MHAAC because I was having problems with my 12-year-old son.
I had a nervous breakdown because I was stressed out too much on my job.
They wanted to put him out of school into an alternative school setting.
My grandson was placed in a youth detention center. On his birthday, we went up to visit him and we put the picture of the cake, on a table and we sung happy birthday around that picture. That was hard.
It wasn't fair. I was mad. I was bullied because I didn't know all my child's rights.
It was something that had to be done.
That's when I knew I need help.
The facility that he was in did offer some mental health services.
And I called the law center and they suggested that I get an advocate.
Once I started to get with other peers and get in here and learning about advocacy and advocacy across the state even, I became more empowered and I felt more respected because people were listening to me.
That was instrumental, just knowing that there's other people going through what you're going through and to keep on and to keep it moving.
He helped me tremendously through the mediation process and still helping me through meetings.
Every time I called him or needed help, he was there.
Not only do they become their own advocates, they become an advocate for others.
Let our voices be heard. We do a trip to Harrisburg every year to meet the politicians. We were able to start reaching out and people believed us.
Stay strong for yourself and stay strong for your family and for your child. But sometimes that's not always easy to do. We need some help in order to do that, and we need some encouragement.
I would recommend others to the Mental Health Association just to help ease the mind of parents like me who have children with special needs.
I've already recommended the MHA to others.
The more help you have, the better off you are. If you have a team for your child, it will make your life and your child so much easier.
It's great to know that there's help out there.
I feel empowered now because I know I have somebody to help me.
Because it's made a difference in my life.
Go get help. Get to the nearest phone, get your information, call directory assistance, and get in touch with MHA.
Don't give up. Stay positive. Keep trying.
There is a place that you can turn to, and that place is the MHA.
We need your support to continue the work that we've done over the last 48 years.